let's start with the heart. Let's find the 4 chambers. This is the right auricle, which is the pig-like ear flap. We open it up, this is the right atrium. Here is the left auricle, and open it up, this is the left atrium. In addition, we have the right ventricle and the left ventricle. We have on the right side the tricuspid valve with its chordae tendineae attaching to papillary muscles, which are the bulges off the walls of the myocardium in the ventricles. On the left side, we have the bicuspid valve. This one is broken. Again, the chordae tendineae, and again, the papillary muscles to which the cords attach. We're going to start by looking at the flow of blood coming back from the systemic circuit. It is deoxygenated. It is blue. It comes in through the superior vena cava and the inferior vena cava into the right ventricle. It flows down into the right atrium. It flows down into the right ventricle through the tricuspid valve. It is then pumped out through the pulmonary semilunar valve into the pulmonary trunk. The pulmonary trunk diverges. This is a blue artery. We are now entering the pulmonary circuit, correct? And it is still deoxygenated blood, but this is an artery because it is moving the blood away from the heart. It branches into the left pulmonary artery. The right pulmonary artery is seen around back here. It's the right pulmonary artery. Goes to the lungs, picks up oxygen, turns what color? Red. And it returns to which side of the heart, the left or the right? To the left. Red blood in the left side, blue blood in the right side. It comes in through a pair of left pulmonary veins and, let's pull the heart off, right pulmonary veins. Oops. So these are the 4 pulmonary veins coming in to the left atrium, and you can see all, wow, this thing is just falling apart. So we've got oxygenated blood in the left atrium. It flows through the bicuspid valve. What is another name for the bicuspid valve?
Mitral.
The mitral valve into the left ventricle. How do you know when if I show you a sheep heart and I pin a ventricle, how do you know which ventricle you're in on a sheep heart?
The thickness.
The thickness of the myocardium, right? The left myocardium is incredibly thick. It has to pump blood through the entire systemic circuit. The pulmonary circuit pumps blood from the right ventricle to the lungs, and the lungs sit right beside the heart in the thoracic cavity, so it does not have to have the same degree of strength. Okay, so we've got the red blood in the left ventricle. It's going to go back behind the mitral valve. It's going to come out through the aortic valve, back behind the pulmonary trunk into the aorta. This is the ascending aorta. Comes over, arches into the aortic arch, goes down the descending aorta to the body. A few things on this model that you need to know in addition to how the blood flows through here. We have the first branch coming off the ascending aorta. This is the main coronary artery. It then branches into many different coronary arteries. If we come up here, the first branch off the aortic arch, not the first branch off the aorta, but the first branch off the aortic arch is called the what?
Brachiocephalic.
This is the brachiocephalic artery. It is not a right or a left because there is only one. This middle branch is the left common carotid artery. Remember, common arteries branch into internal and externals, and that's further up the neck that happens. This is the left common carotid, and this is the left subclavian. It goes under the clavicle. That's literally what that means. And then here is the beginning of the descending aorta. The descending aorta in the chest is known as the thoracic aorta. In the abdomen, it's the abdominal aorta. And then we have this little connective tissue between the pulmonary trunk and the aorta that is a bypass during fetal development. After birth, it becomes just a fibrous ligament known as the ligamentum arteriosum, right? And we also have the fossa ovalis, which is a remnant of the one hole in the fetal heart that bypass purple blood from the right atrium into the left atrium to bypass the lungs. So the fossa ovalis. All right. I think that's it for the heart.